For Careers Week, I'll be speaking to alumni from a range of different courses and careers to talk about their career paths. We'll also be addressing topics such as resilience, workplace wellbeing, and adapting to new ways of working. I'll be speaking to Healthcare Science Alumnus Chris Redmond today, who's currently working as a senior cardiac physiologist within the NHS. He assists in the diagnosis and treatment of patients with heart disease. He'll be speaking to us about work-life balance and managing stress. So nice to speak to you today, Chris.
You too, lovely to speak to you.
Can we just start by talking a bit about your role? So can you tell me a bit about your role and how it's changed over the last year or so?
Yeah, no worries. So I work as a healthcare scientist, or a cardiac physiologist as it's more commonly known within the NHS. So like you said, we deal with the diagnosis and treatment of people that suffer with cardiac diseases. So a lot of my work is based around cardiac devices. So I look after people that have pacemakers in or other devices to help with their cardiac rhythm management. And I also help in inserting these devices in the cardiac cath labs, so dealing with a bit of invasive and non-invasive procedures just in there. And I studied at St. George's for 3 years, so I did the healthcare science degree. And in that degree, you can start out doing resp and cardiac, and then you choose to specialize. So I chose cardiology. I spent the last 2 years of my degree working in training and placement in St. George's Hospital in the cardiac department. So yeah, over the past year, I think it's been very, very difficult with everything that's gone on, but we've managed to cope quite well.
And can you tell me a bit about how you've adapted to new ways of working over the last few months?
Yeah, certainly. So a lot of focus has been placed on what we commonly refer to as telemedicine, or remote working. So I'm part of the clinically extremely vulnerable category, which means I was shielding. So I'm in shielding at the moment. So I've been doing a lot of my work from home, which has been a bit difficult and a bit challenging just because I can't see patients face to face. So a lot of my work now revolves around calling patients and speaking to them over the phone just to assess them and see how they've been feeling, and also dealing with what we call home monitoring. So home monitoring is a system which we did have in place before the pandemic, but which has really sort of boomed since everything that's gone on. So essentially, we give the patients these little home monitoring boxes that sit by the bedside, and we can just monitor their devices and see how they've been remotely. And if we see anything, any dangerous arrhythmias or anything like that, we can contact them, see how they've been, and then sort of refer them for care that way. So yeah, it's been challenging and put a bit of a test to my communication skills and team working skills, but it's been very rewarding just seeing how everyone's adapted and how we can all manage things like that.
And what helps you cope with some of those challenges in your role?
So I think it can be a bit stressful, whether you're working from home or at work. There's different challenges both ways. Obviously, when you're at work, if you work in the NHS, it's going to be busy wherever you are. And a lot of the work I do can sometimes revolve around emergency care. So, for example, if you're in a cardiac catheter lab setting and someone has a cardiac arrest, then we have to deal with helping treat those patients, defibrillating them and all of the rest of it. So it can be a bit stressful, and you can get a bit anxious sort of sitting there making sure that something doesn't go wrong and making sure they act appropriately when things do go wrong. So I think it's very important to sort of manage your stress and keep your anxiety levels low and things like that. So for me, that means maintaining a good work-life balance. So I'm very big on sort of structure and scheduling my day. So I always sort of schedule my day and make sure to include, just some sort of respite, just some things to take your mind off of work and things like that. And even talking to people, I mean, that really helps me. If you go through a stressful situation, there's always people around you can talk to, whether it's in your personal life or whether it's your colleagues and things like that. And there's a lot of camaraderie within the NHS. So talking to people always makes me feel better about if I do experience any stressful situations or anything like that. So I think that's sort of the biggest thing that really helps me, and keeping a good structure to my day and making sure that, mitigating as many things that crop up out of the blue as you can, because when you're in a hospital, anything can happen, and there can be emergency situations that pop up out of nowhere. So it's always good to just sort of keep the surprises to a minimum, I think.
And you've spoken a bit about bouts of stress-related illness during your time on your course. And what helped you strike a good work balance when you were studying?
So I had a sort of, I had a period of time where I was getting very sort of worked up and stressed with exams and things like that. Because when you're in uni, you can have sort of exams and you can have placement to go to, which can be very long hours, and then you have to study for exams and then do essays, and it can all sort of feel like it snowballs and gets on top of you quite easily. So again, I think structuring and scheduling really helped, and I think it's very important. It's easy for people to say, structure your day or do things like that, but it's a very personal thing, I think, dealing with stress. So it's important to do things that work for you. So, for example, for me, I know that I like waking up early and I like sort of getting all my work done and then using the evening to relax. I know some people are sort of night owls, so that was never really me. I was more sort of getting all my work done during the day and things like that, and trying to make sure that I wasn't burning myself out by working sort of late into the evening, and things like that. So I think scheduling it around your own personal habits and things like that is very, very important, because you might be one of those people that does like to work late, in which case, why, unless you have to get up early for a lecture or something, why sort of, wake yourself up really early and force yourself to try and study when you're just not in the mood and you're not going to be productive. So it's working things like that, and making it very personal to you is always a good thing to do. And then when I was at St George's, there was loads and loads of societies and things to do to sort of keep your mind off of work and just keep you occupied in other ways and have a creative outlet. So I was very passionate about martial arts, so I did a lot of martial arts while I was at uni. So every sort of Tuesdays and Thursdays afternoon, I had that training, which helped because it was scheduled, so it fitted into everything else, and it was a good break from revision and things like that. And it really helps to just de-stress. Hitting a punching bag can always be good for relieving any stress. So yeah, I think doing things like that, and it always opens up a world of opportunities, I think.
Thanks. I think that's some really good advice for current students as well. And we might have some who are watching who are thinking about going into a similar line of work.
Yeah.
Do you have any advice for those students or new graduates thinking about their next steps?
Yeah, so I think for students, I think there's a lot of, it's important to know how the structure of your career works and what the career progression is like. So getting on top of that as early as you can is a very good thing. So normally once you graduate, you're looking for a band 5 post as just a cardiac physiologist or a junior physiologist, and then from there you move up the bands to a band 6, a band 7, and things like that. So I think there's a few things you need to think about when you're thinking about applying for work and applying to jobs and things like that. So location is important. If you say you might be living at uni and you want to move back home and sort of work closer to there, so looking at hospitals closer to where you live and things like that is very important. Looking at the job description and really making sure you know what you're signing up for is also very important. And then researching the hospital as well and seeing what procedures they do, because different hospitals will do different procedures and also see a very different patient population. So you'll be dealing with a lot of different illnesses dependent on where you are in the UK, which is a very good thing. It's very interesting because you can sort of bounce around the UK a bit and get loads and loads of different experiences. But when you're looking for your first job, I think you want something stable, and you want to be able to go somewhere where you can progress and you can work towards whatever you might like. And even if you don't know really what you want to specialize in, or you don't know what you want to do, you can apply to these jobs and then just sort of see where it takes you and see what opportunities you get offered, and that will shape the way in which your career goes. And while you're in uni, I think it's very important to almost network in a way and just talk to a lot of different people that are currently employed and get their experiences and see where they've worked, what they thought of it, and yeah, just sort of get a lot of experience and then utilize it.
Thank you. So finally, just following on from that, which skills do you think you developed on your course at St George's that are really useful in your current role?
So I would say that all the clinical skills I gained through placement were obviously extremely important, and through the clinical skills teaching that we had at George's, very important. The academic side was also extremely important because knowing the theory behind everything really provides a good base and a good underpinning of your knowledge just for everything practical. But I think the good thing about the course that St George's offers for the healthcare science is that they have 50 weeks of clinical placement time, which is a lot. And it really puts you in a good standing when you are looking to then apply for other jobs, because you just have such a huge amount of experience from a wide range of sources. So I think that those clinical skills really did help, and the placement time really did help, because when you first join uni and you first start a clinical degree, you might have not had any contact with patients, or you might have barely been in a hospital before, or something like that. So them teaching you the communication skills and the team working skills and interpersonal skills needed to not only communicate effectively with your patients, but also with your colleagues and things like that, are skills that you'll keep for life, even if you chose to go sort of down a different avenue and didn't even do healthcare at the end of it. You'd still have those sort of skills that are transferable and useful everywhere. So yeah, I think that clinical placement time was really a sort of big seller.
Well, thanks very much, Chris. I think that was really useful for
No worries.
students and new graduates. And thanks for taking the time to speak to me today.
No worries. Anytime. Always happy to be here.
Thank you.